Hello, everyone. My name is Nureyan Zunong. I am a Humanitarian Health Advisor with Save the Children. My role focuses on providing technical assistance to Save the Children's humanitarian health programs in both acute and protracted crisis settings. My leadership project title is called Simplified Supervision Tools to Increase Equal Opportunity for Female Leadership in the Community. Goal of my leadership project is to ensure that women not only have opportunity to take up roles outside of defined traditional roles, but their processes and systems are set up to support women in gaining financial and social independence, therefore a place in power dynamics. And in order to achieve that goal, I have chosen a project I have been supporting in South Sudan. South Sudan is a country that has been in the crisis for over 2 decades, linked to conflict, economic strife, and political collapse. It's also a country that was some of the worst health indicators in the world. And the project is called the Integrated Community Case Management Project, and focuses on providing curative health services for children under 5, closer to their homes by working with trained community members, also known as community-based distributors in South Sudan. So the community-based distributors are volunteer position and mostly occupied by women, and the job does not require them to be literate. They are supervised by CBD supervisors. It's a paid position, mostly occupied by men, and the role requires the people to use the checklist and other supervision tools. That means the existing CBDs we have over time will not become CBD supervisors because they don't have the required literacy level. So my leadership project looks at addressing this specific barrier by developing a checklist that can be used by illiterate or semi-literate CBDs. The success of the project will be measured by increased number of female CBD supervisors over time. Like everything else, my leadership project was also disrupted by the pandemic. Although we have been able to draft ideas for the new supervision tools, but we have not been able to discuss it with the CBDs and test among them. Because of COVID, the CBDs are required to take up extra responsibilities and also function in an environment where they are at risk of contracting COVID. In this situation, and in order to address these challenges, we focused on developing some guidance and tools, resources, so the CBDs can function safely in their role and also be able to provide the most needed health services. Also, we were not able to provide career paths for CBDs, but we were able to ensure their safety and the continuation of essential health services during last year. My leadership journey has been very rewarding. I learned to focus on my objective, but at the same time be able to adjust the pathways and address the emerging challenges. But most importantly, I learned that leadership is not necessarily about big numbers or big challenges, but bringing meaningful changes and creating lasting impact. Empowering a woman to have a paid job, hence bring some financial resources, does not only mean we have one female supervisor, but it means there is an empowered woman, and it means there is a family that the mother can support her daughter to go to school. There is a family that educates sons to recognize and respect that women belong in leadership position. This will be a beginning of a community that is more gender sensitive, fair, and healthier. And I would like to end my presentation with a quote from Lao Tzu: "The journey of 1,000 miles begins with a single step." I believe this leadership journey enabled me to take up my first step with confidence. Thank you.